We will go ahead and get started. It's 6:30. Welcome everyone to our open house, enjoying the holidays safely during the pandemic. We are live on Facebook, so hello to all of our Facebook friends with us today, right now, and in the future. We want to start off with a few housekeeping announcements. The Zoom controls are at the bottom of your screen. As you come in, please do mute yourself, and of course we will have opportunities for you to be able to speak. And you can also use the chat box, so you should be able to find your chat box either at the bottom of your screen or on the side of your screen. Please type in any questions you have during our meeting. And then again, mute yourself, but we will have opportunities for you to be able to unmute and ask questions of our guests today. We are so excited. We have several guests with us today, but we also have two special guests, Rhonda Rawlings with 107.3, and we also have Dr. McFadden from Prisma Health System. So we will introduce them fully in just a moment. Again, welcome to you. If you've just joined us, we are on Facebook Live currently. We will give just another 30 seconds or so for a few more people to join us, and then we will start with our moment of silence before getting into our program today. Again, welcome to all who are with us. We are live on Facebook, and we also have several people in the Zoom room. And once again, if you are in the Zoom room, be sure to mute yourself, but we will have opportunities for you to participate and unmute yourself. If you have any questions, please be sure to put them into the chat box. We will have plenty of time for questions, both through the chat. We'll be monitoring it, and also at the end, you can unmute yourself and ask questions. So at this time, we'll go ahead and open up with a moment of silence. Today, in addition to COVID-19, the reason that we've all come together to discuss how we can stay safe during the holidays, we also recognize that there are many of us here today in this room who have been impacted by HIV/AIDS. The United Nations and communities around the globe are commemorating today World AIDS Day with a call for global solidarity and shared responsibility to overcome not only COVID-19, but also AIDS. That's another global pandemic that is still with us nearly 40 years after it has emerged. So I ask that you join me in a moment of silence for all represented in this space who have lost loved ones to either of these pandemics. Thank you. Again, welcome. Sustaining Way is so excited to have you here with us, and we definitely want to learn from our guests today about how we can enjoy the holidays in the midst of the COVID-19 pandemic. Sustaining Way is an interfaith nonprofit that educates, demonstrates, and collaborates to empower South Carolina communities to cultivate a sustainable and equitable future. Our base of operations and education center is located in the Nicholtown community in Greenville. At the end of tonight's discussion, we will give you an opportunity to take a virtual tour of our flagship project, Annie's House. Everything we do is in an effort to care for people and the environment in a sustainable way. Our simple definition of sustainability is to provide for people and the environment in an affordable way. Social sustainability and healthy lifestyles are just two of the 6 areas we model at Sustaining Way. And these encompass personal practices for human well-being, equity, and democratic civil society. We're very grateful for your presence as we discuss ways that we can care for ourselves and love our neighbors this holiday season through the lens of those two areas of sustainability. Before introducing our team, I want to acknowledge everyone who has donated to Sustaining Way today as part of our Giving Tuesday activities. We've raised today, or to this point, about $1,500. And we're thankful to many of you who are with us today for helping us get to that point. As we head into the final hours of today, I encourage you to go to Sustaining Way's Facebook page and share our live giving event. All donations will be matched up to $7,000. So please invite your friends. Our website and Facebook addresses will be in the chat box, so you can go there to find out more. Now, this time I want to take the time to introduce our fantastic team. We have with us our founder and executive director, Rick Joy. And Rick, if you'd like to share, please do.
Yeah, just welcome to Dr. McFadden and to Rhonda Rawlings. Thank you all for joining us. I appreciate it, and welcome to everybody.
Thank you, Rick. So I am the program director here at Sustaining Way. And again, so glad to have you all here with us. We have Sophia, who is our research and marketing specialist. She is helping to make sure that everything runs smoothly this evening. We have Michelle, our sustainability education coordinator, and she is here to make sure that we are knowledgeable about all things sustainability. We also have Xana and Danielle, our sustainable agriculture coordinators, who are working hard in the community to help us develop sustainable ways to feed ourselves. And we're really excited about the projects that they're working on. We have Amber Jacobson, our engagement intern. Callie, I believe, is either with us or is going to be joining us soon. And then I believe I saw Kayla enter the room. Kayla is one of our interns. And I may have missed,
Michael Brown is on, I think.
Michael Brown is with us as well. Michael Brown is our vice board chair. So thank you for being with us, Michael. And I believe I may have skipped over Oscar, who is with us. He is our executive coordinator. Let's see, did I introduce everyone? All right, so it looks like I've introduced all of our team, and now we have a couple of guests who are here with us. So I do want to again recognize our guests who have joined us for this evening, and we will get to a full recognition of our speakers for this evening in just a moment. But again, thank you, Dr. McFadden, who is here with us, Dr. Cedrek McFadden, as well as Rhonda Rawlings. So again, if you are here with us on Facebook Live, we are kicking off our Enjoying the Holidays Safely During the Pandemic, and we also have our fundraiser going on today. As we move into the next section of our meeting, we want to encourage all of you to share with your friends. Please do share on Facebook Live with friends. Invite them to join us this evening, either in the Zoom room. They can still register, and they can also just join us through Facebook Live as well. And we just had someone else join us. So hello, welcome to the room. So we are all here this evening because everyone in this room has been impacted by COVID, whether you have been directly impacted with illness yourself or someone in your family being impacted, or because of the challenges and the changes that we're all experiencing together as a result of the pandemic. Many of us have also read recently about the increasing cases, and unfortunately in Greenville County, where most of us are, that is the case as well. The latest data from DHEC confirms that there have been Over 200,000 confirmed cases in South Carolina, unfortunately. And unfortunately, we've experienced over 4,000 deaths as a result of COVID-19. And we certainly want to make sure that all of us here today, everyone in our community, and all those throughout our state are safe and secure over the holidays and able to enjoy time with their loved ones and do not have to be one of the statistics that was just quoted. So this evening, we have Dr. McFadden and Rhonda Rawlings, who are here to help us navigate the holidays in the midst of this pandemic. Dr. McFadden graduated with honors from Xavier University of Louisiana in New Orleans. He earned his medical degree from Temple University School of Medicine in Philadelphia. His medical training includes residency in general surgery from Greenville Health System and the University of South Carolina, Greenville. He is a member of the American Society of Colon and Rectal Surgery and the American College of Surgery. Dr. McFadden is a board-certified colorectal and general surgeon and teaches as a clinical assistant professor of surgery. He also lectures nationally to hospitals, civic organizations, churches, and community groups. Thank you so much for being with us. We're looking forward to hearing from you. Ms. Rhonda Rawlings. Rhonda studied radio, television, and film at Temple University and worked in Los Angeles before coming to the upstate. Rhonda served for 10 years as the News and Community Affairs Director of Summit Media Greenville, and now she serves as the Community Affairs host for this company. She served as a local producer for the Tom Joyner Morning Show and the host and producer of 2 Sunday morning shows, Pause for the Cause and Hot Topic. She was the recipient of the Merit Award for Radio Reporter of the Year in 2011, 2015, and 2018 by the South Carolina Broadcasters Association. Rhonda was also made the Communications Director in South Carolina for Cory Booker's 2020 presidential campaign. We are so grateful to have both of you here with us today. And I just can't wait for Rhonda to interview and have this conversation with Dr. McFadden. Many of us listen to you, Rhonda, on the radio throughout the week and see you on television. And you have always informed us as well as entertained us. So thank you so much again for being with us.
Thank you. Thank you. Okay, should we get started?
It's all yours. Thank you so much.
Well, first of all, thank you so much to Sustaining Way for asking me to moderate today's forum. I think it's very important and very needed. And thank you so much to Sustaining Way for all that you are doing in our community. I'm a big fan of the organization. So I'm excited to talk to Dr. McFadden tonight. I did have him on my Sunday show, and he is a wealth of information. So first of all, I know that we're talking about enjoying the holidays safely during the pandemic, but I just wanted to start off asking you, Dr. McFadden, to just give us a little background on the coronavirus. We've been, in the midst of the pandemic for, I think this is the 9th month now. So just give us a little background and talk to us about just what the coronavirus is, COVID-19.
Absolutely. And thanks again to Sustaining Way for the invitation and for the opportunity. But you've likely heard a number of reports by now, and you could probably recite the narrative. But let's go back to the beginning. As your question asked, COVID-19 is a type of respiratory virus. It's a type of infection that causes flu-like symptoms. The coronavirus itself is not anything that is new, but this particular strand of the coronavirus is new. We've had coronaviruses manifested throughout history for several decades, but this particular strand, this COVID-19 or this coronavirus, this new one that we saw emerging on in December 2019, is the one that obviously has caused the whole world to take notice of its presence. But it is a respiratory virus that causes a number of symptoms that I'm sure we'll get into very shortly.
And I'm glad you mentioned the flu. So can you talk a little bit about the differences? Because there's many people still to this day that are saying yes, people are contracting COVID-19, but they're also contracting the flu, and people also die from the flu. So I think it's important to address, what the differences are.
Well, there are some of those differences that are noticed in the symptoms of them. Let's start there. The symptoms of COVID-19 can primarily, as you remember, can be fever, a cough, or trouble breathing. And then there's a whole litany of other things that are very different from what you'll see in the flu. For instance, if you have a loss of taste or smell, that's not coming from the flu. That's very typical of what we've been hearing about from COVID-19. Likewise, we initially were concerned because the flu we had a vaccine for. We had a history of knowing how the flu normally operates, but this particular coronavirus infection, we didn't really know what to anticipate, how it was going to function. We didn't have a vaccine, and there were no real good treatments available. So there were so many unknowns about it. And initial reports showed that this particular coronavirus was perhaps much more infectious, meaning it would spread more readily between people. And so that became another concern, is that one person could perhaps be responsible as a super spreader, where you can have multiple people infected from just one person, which is very typical for this one, but not so typical for the flu virus. So those are some of the big differences that we've seen between COVID-19 and the flu.
Okay, and so what would prompt them to go to the hospital? Because some people may be confused about, if they're having a cough or if they're sneezing. Of course, these could be, like you said, it could be regular symptoms of a cold. What are some of the symptoms that you would think a person would say, maybe this is something more than that and need to seek medical attention?
Sure. Well, fortunately, most people who have been infected with COVID-19 have had mild disease, meaning they primarily have the cough, the fever, a shortness of breath. They may even experience headaches, muscle pain. They may experience some nausea or some GI upset. So those are some of the other symptoms that came out along the way. But the ones that really bring it to your attention are primarily those that cause trouble with your breathing. If you're having trouble speaking or can't walk because you're gasping for air, that's a problem. If you notice that the lips are turning blue because you're not getting enough of this oxygen-rich air, that's a problem. Even if you're becoming more confused, and this is one of the things we see in perhaps the elderly, in that they may exhibit other signs and symptoms. So if you notice that they're becoming less cognizant, they're becoming less conscious, that's another reason to call 911. And so that's the reason why you should be seen. But again, those are the common things, but fortunately, most people who have COVID-19, we got to reiterate that, have mild disease. And in many cases, they can stay at home and self-care.
Can everyone hear me okay?
Yes,
okay.
I can.
Dr. McFadden, I'm not sure if it was my phone, but you were breaking up just a little bit. But so one of the things that is very concerning about COVID-19 is that many people are asymptomatic and don't have any symptoms at all with it, correct?
Correct. And the concern is that perhaps when people are most infectious, meaning those first couple of days after you've been infected with COVID-19, that's when you're starting to ramp up your ability to infect other people. Well, if you don't have symptoms, you may not know that you need to be staying particularly away from people. And that's the reason why we then spread it. So it's an asymptomatic presentation that's concerning about increasing the spread of this infection.
Okay, and just want to remind everyone that if they think of any questions while we're discussing, you can go ahead and ask those questions in the chat. So speaking of people that may be not have any symptoms, this is why it's so important for us to wear masks. Now, there are some people who just refuse to do it, some people who are very up on it and will do it no matter what. So can you talk to us about the importance of that, about the importance of wearing masks, and do the masks just protect other people from us when we're wearing it, or will it protect us from other people as well if they're wearing a mask?
And that's a great question, and that's a great connection to, you almost have to treat everybody as if they have COVID-19. And you have that universal precautions, meaning you have to maintain that social distancing. You also have to wear the mask, and the masks themselves are not going to provide all the protection that you need. So it has to be done in conjunction with providing that social distancing, that physical distancing between other people, washing of the hands and keeping, good hand hygiene. But the mask protect, certainly the person that you are around, but also there's some evidence that shows that it protects the person wearing the mask. Because, if you can think of two people that are standing next to each other that may be wearing a mask, there's going to be less of those viral particles that can spread between the two. And so the more barriers you have, the more protected those people are going to be. It's also important to remember the type of mask that you're wearing. You've probably seen every store, every gas station, every discount store, they have masks available. And not all masks are created equal, okay? So there's some masks that are too thin. A lot of the buffs that I think a lot of the teenagers and younger people like wearing probably are not as protective as the cotton, the 2-layered mask. And so, wearing a mask that's appropriate, you want to make sure, I've seen commercials that show if you can blow a candle out through the mask, that mask is probably not as effective as you'd want it to be. But you also need to breathe, right? So we don't want you passing out because you have a mask that's too thick that you can't breathe and function. So finding one that is comfortable, whether it's behind the ears or one that you tie above the head, finding something that you can wear, leave it in place, put it over your nose, not underneath your nose. And certainly you don't want to touch it and manipulate it all through the day because that's increasing the potential risk of infection.
And for those of us who wear glasses, I'm not wearing mine right now, but I find it helpful to sort of put the mask under your glasses so your glasses don't get all fogged up, because you want to breathe and you want to see as well. So
you got to see, right? But there is a trick that you can do with the glasses. You can either get a piece of tape. Some people use a Band-Aid, which works really well, but just take the Band-Aid and put it over the bridge of your nose, right where that mask is, and that will keep that air from going up to the glasses. It's a great trick. Tell your friends about that one.
Great info. I told people you were a wealth of information. So I want to ask you, lately reports have said that we are seeing an uptick, and they predicted that we would see an uptick all through the summer, where some people were saying the heat during the summer is going to kill the coronavirus. Then some people said the cold in the winter is going to kill the coronavirus. There's so many myths out there. Do you want to address any of those? Because I think some people are falling back on myths and getting a little comfortable.
Yeah. Well, a lot of what we saw this summer, while the concern was that will the warmer weather affect it? If you remember, probably May, when we were seeing, what was happening on the other side of the world, like in New Zealand, they were still seeing uptick in cases. Even in the Middle East, they were still seeing uptick in cases, even though it was already warmer in those places. So there was already concern that it really wasn't going to be a great win when it really got warm. But I will tell you another reason why perhaps we saw an uptick perhaps over the summer. Think about what was happening over the summer. Of course, we have Memorial Day, we have 4th of July. There was a lot of interaction. There were still a lot of people that were gathering together. Certainly we had protests. There was a lot of grouping of people without masks even earlier on that then contributed to it. So the myth regarding the weather affecting it, I can't say that we can hang our hat on that. And another reason why when it gets cooler, that may increase the risk is because what happens when it gets cool? People don't go outside, they gather together in tighter places, which then perhaps increases how that virus is transmitted from person to person. So several different layers to make on that, not to mention that we're entering or we're in flu season now. And so that in conjunction with COVID-19 can perhaps be a deadly combination and certainly can potentially overwhelm our healthcare system.
Wow, and I'm glad you mentioned that. And then we're going to get right into how we can enjoy the holidays being safe. But a lot of these tips that you're giving are letting us know how to enjoy, any day safely. But wanted to ask you about the flu vaccine. Now, it's being encouraged right now for people to get the flu vaccine. I get mine every year. I haven't gotten it yet, but some are concerned with the coronavirus. Now they're scared to get the flu vaccine. Does that any way interact, or can you speak to that? Why is it so much more important now to get the flu vaccine with the coronavirus running rampant?
So let's first go talk about vaccines in general. So vaccines essentially work by tricking your body into fighting the infection for which you're being vaccinated against. So it allows your body to ramp up or to prepare to fight even before it comes into contact. So essentially, it's standing around the corner waiting for that virus should you come into contact with it. It's waiting there for it. It's already armed. It's gathered to attack that virus. You cannot get the flu from the flu vaccine. Neither should you get COVID-19 from the vaccine for it. Because again, you're only taking a part of that particular virus to get the body creating an immune response against that particular infection. The reason why you should get the flu vaccine is just that you can get both the flu and you can get COVID-19. You can get both, and you can get them at the same time. And so the idea being that you don't want to overwhelm not only your system, but also the health system. I mean, if you can think about the increased numbers of people being admitted to the hospital because of COVID-19, well, you add that along with the people that are in the hospital for the flu, the people that are requiring ventilation. We only have so many hospital beds. We only have so many ventilators. If we overwhelm the system, people who otherwise could need those equipment options may not be able to get them. So that's why we really have to take care of ourselves and our families and encouraging them to get the flu vaccine as well.
Most definitely. And so right now, a little earlier today, I heard that the flu vaccine will be available, not the flu vaccine, the COVID-19 vaccine will be available at the end of this month in limited quantities. So they're going to see who would be priority to receive that vaccine first. And they're saying healthcare workers, that type of thing. But I also heard that towards the end of June, the vaccine may be available widespread. And there are many people, once again, who are very cautious about taking the vaccine right now. I want to particularly address our African American community, certainly with any trials or anything like that, very, very cautious because of history, because of the Tuskegee experiment. So can you talk to us a little bit about the COVID-19 vaccine and how you are feeling about it?
Right. Well, I'll tell you that all the vaccines, there are multiple different trials going on around the world. There are about 12 that are in the final stages of testing. I think the Johnson & Johnson requires one shot to be given. All the others require 2 shots to be given several weeks apart. And it takes about 4 weeks for that vaccine to take full effect, okay? The initial one that came out from Pfizer, I think they had the capability of having probably 15 to 30 million doses available by the end of the year. And they suspect that they can have up to 1 billion doses per year. And so if you combine that with all of the other ones, there's a potential that we can have enough for everybody. But again, the states are going to have to determine who gets the vaccine first. The concern about the safety of the vaccine, and certainly in certain groups, African Americans, which we've known for some time, not just COVID-19, but against the flu vaccine, against the vaccine against HPV, as a general rule, African Americans are very hesitant to get vaccine. And you mentioned sort of the history of prior medical experimentation without informed consent and how that breeds mistrust. And the medical group, the doctors, we have to own that. We have to own that we're perhaps responsible for that. We also have to own some of the conversation that may not be very clear. The language may not be understandable. We have to own the fact that we have to use real talk to explain kind of what are the risks and benefits of that. We also have to not get rid of the idea about the role of religion and spirituality. In many groups, we have a really strong reliance on faith. And so we rely and we say, well, that's not going to be necessary because of my faith. And there's also just sort of wise tale, well, when I got this, I got the flu, or I may have had symptoms from the flu, and we can talk about that later perhaps, where I may have symptoms from COVID-19 from this particular vaccine. So there's a lot of historical inaccuracies of kind of folklore that we've passed along. But we really recognize that the initial data shows that this vaccine is quite effective. The vaccine from Moderna that was reported yesterday, I believe, showed that none of those folks got severe cases of COVID-19 out of that trial. And so there's a lot of excitement around sort of these 95% effectiveness of these particular vaccines coming out. So my personal belief, you know, as a healthcare worker, I will certainly be one of the first persons that'll be offered the vaccine, and I anticipate partaking and having that vaccine so we can continue to provide the care that we need to. And so we're going to all have to do our part to get the message out. But you know, those are strong things to work against and to educate against. And there's going to be some that still won't, just like there's some that still won't get the flu vaccine, et cetera. But we have a lot of work to do to get into the communities, to have one-on-one conversations and do education, just like Sustaining Ways does. So thank you again for this opportunity.
Great. So it seems like there is a glimmer of hope on the horizon with that. So now let's talk about the holidays and how we can enjoy the holidays safely, you know, with our families during the midst of a pandemic. We just passed Thanksgiving. And even though with the uptick in cases, reports came out that people were traveling. What is the safety of travel right now at this time with coronavirus? Maybe airplane travel? What are your thoughts on that?
Well, so airplane travel initially decreased right afterwards. In March, April, there was obviously fewer people getting on airplanes, and then we saw reports coming out that, you know, that perhaps it was safer to travel in airplanes and some other modes of transportation. But let's talk about what's the problem with airport travel. You're interacting with more people, you're still in confined spaces, and there's more of a tendency for people to let their guard down, perhaps either when they're sleeping, if you're on an airplane, if you're walking, you're touching things, you're perhaps not cleaning your hands as well. And so it's harder to distance when you're in an airport. You saw the news, how many people were in the airport. And so it becomes very difficult to do those social distancing, to keep, you know, yourself safe. But let's face it, people are still going to travel. And so there's been a great responsibility from the airline industry and perhaps most industries to provide as much safety. They've been looking at the ventilation on the airplanes and looking at kind of what their attendants can do that can keep people perhaps safer. And so, you know, I still advocate, unless it's necessary to travel, you know, please refrain from doing so. If you're having to travel, keep in mind where you're traveling. You know, if you're going to some exotic locations, you may be asked to quarantine either when you get there or either when you get back. And so you have to really think about all of that when you're planning a trip or traveling. Even if you're going up to the Northeast and coming back to the Southeast, there may be restrictions when you get back to work to say, well, you need to stay home a few days because of your travel. So really think about the before, during, and after when you're planning a trip.
And do you feel that people, being that the pandemic has been going on for some time, that people are getting a little more lax with their care of themselves as far as coronavirus is concerned? And what about being around your family? Like, we know some people, everyone's on social media. We know some people gathered for Thanksgiving. There may be a feeling that this is my family, so I can, you know, congregate with my family. Yeah. But really, you're not supposed to congregate with anyone that's really outside of your household, correct?
Right. Yeah. Your family and friends. Yeah. Your family and friends can still infect you with COVID-19, even if you love them. All right. So, and that was a part of the uptick of what we've been recently seeing. It's not so much these big gatherings, it's the social group. It's your best friend, it's your family and friends that you're gathering with, that you perhaps get comfortable. You take the mask off when you get in. They're okay. I think they're not going to get me sick. And that's been responsible for a number of these cases that have been coming out more recently. And so that is particularly why when you have these gatherings, the recommendations are that you don't have gatherings with people who don't live in your home, that you keep those numbers smaller than 10. And that's been the recommendations, but as you mentioned, you've seen people who have not done that. But it's a sacrifice we're all going to make, and I think we will turn the corner. We're going to turn the corner. This is a very temporary thing, but we just have to all do our part right now until we get there.
And so would you recommend, some people may go, and like you said before, don't congregate in groups larger than 10. And then the people that come to your home need to be the people that live in your home. But what about people that, it's the holiday season, people want to go out to restaurants, they want to go out to different parties. What are your thoughts on going out to restaurants right now? Is social distancing okay if you decide to do that?
Well, I personally, I've not been dining in a restaurant since it started. Obviously, people have ordered takeout and things like that. But the restaurants, they really focused, especially during the summer months, like getting people outside, getting creative on how they can have people enjoy the meals. And so I think if done safely, that is an option. But everything that you potentially do, and you have to sort of ask, what's my risk? Everybody, the rules may not be exactly the same depending on your own health risk, your own comorbidities. We know that people who have chronic illnesses such as heart disease, diabetes, lung disease, people who are immunocompromised, who have cancer or may be on steroids for different things, they may not be able to fight this like other people. So you really have to look at your own risk factors and make some of those assessments of whether or not it's worth going out to a restaurant, even if you are distancing, even if you are doing the things that you can do to be safe. I think you're on mute, Rhonda.
Okay. What would you recommend? We saw at Thanksgiving, a lot of people did virtual gatherings through Zoom, a forum like this or another forum. Is that something you would suggest with the Christmas holiday as well?
Well, we're still in the uptick, and I think over the next couple of weeks, we'll see the uptick from Thanksgiving. And so I think it's most likely that we're going to be hearing the same messaging, that over the Christmas break, consider having Zoom meetings without meeting in person. I mean, think about it like this. It's a great way to not eat as much when you're sharing dinner over Zoom, right? But I think it is a recommendation we'll likely see through Christmas as well.
And I think, that is the key as well, is to realize, as we talked before, that even though you don't have a symptom and you feel fine, you still may be positive for COVID-19. So Correct. You don't want to bring that to your family. You definitely don't want to bring it to your elderly members in your family, or anyone who may have, like you said, heart disease or asthma or anything like that. So that is the risk in it, I think, is that a lot of people may say, I feel well, or this person looks fine. Nobody's sick, nobody's coughing, nobody's sneezing, but they still can be carriers of the virus.
And Correct. We also know that correct. And we also know in certain groups, such as in African Americans, they have higher death rates from COVID-19. And so, groups such as African Americans really have to, pay due diligence, making sure that we're protecting ourselves, because in that community, you can really spread it and you can cause more, more deaths just in that community because of the comorbidities, because of some of the other issues, such as the social determinants of health that you've heard people talk about. And so that becomes a bigger message that we have to have even now.
And I wanted to ask you one more thing, and then I want to open it up to you, Dr. McFadden, to give your last thoughts on COVID-19. Can we talk a little bit about the quarantining? Can you talk about what's necessary with that? We talked about people being asymptomatic. Being that people can be asymptomatic, should people go ahead and just get tested just in case? And is that possible? for them
Well,
to
I
do?
mean, I would love it to the day that we could have home tests. We could just have tests readily available, almost like a home pregnancy test, where it's just sort of, easy to do. You know for certain, but in many cases you don't know. And so when you have contact with someone who has been tested positive for COVID-19, and you're not having symptoms yourself, well, that's a situation where you really want to, number one, self-monitor, look at your own symptoms that you may be exhibiting. And if you've had close contact, that's also a time where you can consider quarantine. That means staying away and seeing how you develop. Now, the problem with that is, we're now seeing that tests are more available. So we could actually now, several months ago, when those tests weren't available unless you had symptoms, people did have to quarantine. But now people are just getting tests. And that's probably ideal because, again, it keeps people out of quarantine that may be COVID negative. But if you've had close contact with someone who's tested positive, consider getting tested. If you've also had symptoms yourself, get a test. And then if you've tested positive, then you're required to isolate. You're required to isolate from 10 days from that test if you don't have symptoms, or if you do have symptoms, 10 days from the start of those symptoms, until you've had 24 hours of being fever-free and 24 hours of having no symptoms. I know that's a little bit confusing, but think about it. If you do not have symptoms, and you test it positive, you're in isolation from 10 days from that date of that test. If you have symptoms, 10 days from the start of those symptoms, including 24 hours of having no fever or no other symptoms. I think you're on mute.
I'm muted again. Alicia, I wanted to see if someone could read the questions from the chat, but first I wanted to give Dr. McFadden just a moment to give us his final thoughts on COVID-19 and the holidays, or COVID-19 in general. Any final thoughts that you can give our community and our listeners today?
Yeah, I think we all need to be encouraged. The fact that this has gone on for so long, it is tough. And there is such a thing as, COVID fatigue, pandemic fatigue. We're tired of hearing about it. Some of us are tired of experiencing it, not seeing our loved ones. But I think if we put in the perspective, this being a very temporary thing in sort of a long-term situation, at some point we would get over COVID. It will become a part of kind of how we operate, but it's going to take some time. And I think we all have to continue to do the right thing, even when it's the hard thing. And so that means Christmas, not really visiting all your loved ones face to face, taking advantage of digital sources, taking advantage of mailing gifts instead of bringing them in person, dropping them off. And we did it for Halloween. We're going to do things differently right now. But I do believe that this will get better, and this will become a thing that obviously we'll learn from, but we're not over it yet. In some cases, we're going to see things heat up over the next month or so.
Dr. McFadden, thank you so much for answering all of our questions. I think
Thank you.
that you will have people being a little bit more cautious if they let their guards down a little bit already. I know you have me thinking about some things, because I do go to a restaurant every once in a while. I try to sit outside, but I hope that people will, anyone who has gotten a little bit of lax due to COVID-19, what did you call it? The COVID fatigue. Will really think a little bit more about their choices going forward. And I know we have some questions in the chat. Is there someone that can see them and read the questions in the chat?
First questions from Ms. Sabrina Simpson. She asked, should people still get the vaccine if they've had COVID already?
Well, I think the first question is going to be, are they going to be able to get it? And so the big question, and I'm going to take a long way to get to the answer. The big question is, how much immunity do you have from COVID-19? If you've been infected, is it a month? Is it 2 months? Is it 3 months? Is it a year? I don't think we really know the answer to that question. And so a part of the conversation about who gets the vaccine, and these are some of the things that they're working through right now at the CDC level, is how are they going to distribute it? Because right now we don't have enough for everyone, and we don't have enough for the general population to get it. But I would not exclude someone who's had COVID-19 from considering getting the vaccine, because we don't know how much protection you have and how long that protection is good for. That's probably going to change. That thought process will likely change as we have, again, limited options for giving people the vaccine, and we'll likely see an evolution of that thought.
Okay, thank you. Another question we have is from one of our education coordinator, Ms. Michelle. She says, are COVID tests before traveling, gathering, providing a false sense of security?
Yeah, they are. I still think it's a good idea. I mean, I think it's a good idea before you are traveling to give yourself, a 14-day period of quarantining, making sure you're being really diligent, getting the test before you go, and certainly when you come back, being careful and perhaps quarantining or getting another test if you can. But it can, because you can still have a negative test and be infected with COVID. You could also still, transmit even if you're not having symptoms. And so we saw a report a few weeks ago about a family of 14 that was out, and they did all the right things. They quarantined, they took a test, and at the end of that trip, 11 of the 14 or so got the infection. So you can still get infected even doing the right thing. And so that's why the recommendation is, unless you really have to, please limit it and really stay away and do things virtually.
Okay, all right. Next question is from Mr. Michael Brown. Doctor, what about indoor environmental conditions as it gets colder? Is there an increased risk of dry heat in our workplaces and restaurants, etc.? And what about the use of humidifiers? Safe or not safe?
Yeah, so initially there was a lot of conversation about the ventilation in restaurants and how they circulated air and how that may increase the transmission of COVID, because again, these particles then get caught up in the flow of the air and then it potentially will spread to another person. The danger of indoor during the winter time is just that we're closer together. We're not opening our windows and doors because, let's say right now in Greenville, it's at 30 degrees. And so no one wants to have that cold air. So we're keeping all of that there without a lot of extra moving air from the outdoors. And so that can increase that risk. The temperature at which the virus can sustain itself obviously is different in the winter months versus the summer months, but there's no clear-cut answer that says it's not going to survive in that, if you keep your house really warm as opposed to keeping it really cold.
Okay. All right, thank you. Mike, I have a question. I don't know if you spoke about it earlier. Are Black people dying at a higher rate because they are not doing what they need to do to protect themselves?
Well, it's a combination of things. I mentioned a term earlier, the social determinants of health probably bears at least a 1-minute description here. It's those things that make it less likely that you will have a better outcome. For instance, we know that a lot of the frontline workers are African American, they're Hispanic. And if you are having to go work at the post office, if you are having to be that respiratory therapist or that nursing aide, if you're having to be that bus driver, you may not have the option to work from home. And even if you have that option to work from home, are you in a place where you have an internet desert, where you don't have access to internet stuff to do that from home? And so it sets up a bunch of different reasons why you're going to have to go to work, where you're going to have to be frontline and perhaps be more exposed. So it's not just that we're not following instructions. It is some of the fact that we have higher rates of chronic illnesses, but it's also the other things. It's how much when you get to the hospital, are you being listened to? Are your doctors taking your complaint seriously? We talk about having, is there, systemic racism? Is there a barrier to them getting the treatment that they should get when they get there? So it's a whole litany of things, and it's very easy to blame that on just having more diabetes and heart disease, but it's a lot more than just that.
Okay. All right, thank you. Next question from Ms. Amber. Can you speak on what it is like to be a healthcare worker right now?
So it is a challenge. Fortunately, a lot of what we're trained to do prepares you, but I think everyone will attest, we've not seen anything like this before. We've all had to modify how we see patients. Surgeons, for the first time, many of us were doing telehealth visits, which is not something anyone would ever think a surgeon would do, but that's something that we've had to incorporate. We've all had to make adjustments, just like we all have on having patients and their families come. That's perhaps the hardest thing for me, because often I think patients require having loved ones there during their periods of recovery. And so we've had to limit the number of people that can come visit, which in some cases may hinder the recovery process. It also makes it more difficult to communicate, especially if you have an elderly relative or friend. You have to make time to pick up the phone and call the family and say, this is what's going on with them today. And that can be a barrier. That can be hard to do. And it can make it really difficult to really make those connections that we need to make. So I think that a lot of the healthcare workers are tired. They've had to take extra precautions to keep themselves safe, but also their families safe. They're perhaps sleeping in other rooms from their loved ones because they don't want to risk getting their loved ones exposed. So it has been a great deal of work on your healthcare providers. But again, that's why we're here, and that's what we've been called to do. So, we all have a part to do and play.
Okay. Next question is from Mr. Alan Mitchell. Is there anything we should say to individuals who hate masks and are encouraging others not to wear them?
All right, so that's a big question, right? So there are some people that just will refuse to wear masks, and there are a number of reasons why people may refuse. You've likely heard people say, well, I don't want to breathe in my own carbon dioxide because it's going to make me sick. I wear a mask every day in the operating room. I've had masks on for hours at a time, and I've never gotten sick from my own carbon dioxide. Additionally, some people have commented on the mask are not very comfortable. And so to that, I say, find a mask that is comfortable. If it's tight behind your ears, find one that goes above your ears. If it is too confining to the face, find one that has a different configuration. I think ultimately the science shows that masks will reduce the COVID infections. We've seen it happen in societies where we have had mandates for masks. I think we all have to model the behavior that we'd like to see. And so that's why we all have to do our part. Even if someone's not wearing a mask, you wear your mask, you do what you should do, and really that's all you can do.
Our next question comes from Zana. She asks, is there concern for local test availability to become unavailable with this uptick?
We've had that concern initially. I think that's probably less of a concern. I think the types of testing may be different, meaning the concern for how much we have available. Like in the hospital settings, there are certain rapid tests that are perhaps more readily or perhaps are more limited than, say, the tests that you get over 2 or 3 days. And so the type of test may be limited, but there are still lots of tests available, if that makes sense. There are lots of testing sites. You can go to the CDC's website, you go to DHEC's website, you can find a list of them. CVS, the hospital systems, they all have these testing centers available. And so really take advantage of them.
Okay, we have about 2 minutes left. So I'm gonna take the last 2 questions. Another one from Mr. Alan Mitchell. It is, how does your experience with COVID-19 compare with your experience with the Ebola outbreak?
Say that one more time, you broke up.
Oh, I'm sorry. How does your experience with COVID-19 compare with your experience with the Ebola outbreak?
Well, Ebola was we didn't see the wide outbreak that we're seeing with COVID-19. I mean, we certainly saw, if you looked at the news, what was happening in Atlanta and some of the higher density places, but we didn't see that same thing in every population, and we didn't obviously have that same concern that we have right now. So I think that the experience now is that we're recognizing this is much more, potentially more universal, and we're seeing it in numbers that we just didn't see before with other pandemics.
Okay. And last one for Ms. Yvonne Reeder. You said that one that has COVID. I'm getting tongue tied. You not sure how long. Okay. I think she's asking that you said one that has had COVID. You not sure how long the immunity will last. Then do we know how long the vaccine will protect, or if the different strands appear? I'm just saying if the vaccines, right, might change. I mean, the virus might change, and like how that'll go about.
Right. So all viruses mutate. All viruses change. And not every change that happens is a problem. We sometimes think of a mutation meaning it's a really bad thing. It's just sort of how viruses behave. And most of the mutations that happen, you wouldn't notice, and the vaccine would still protect against. We've had very limited data with how long the immunity will be for the vaccine. And that's why anybody that's participated in any of these clinical trials, they're going to be followed up to 2 years, if not even longer in some cases, to see how they're doing. Are there adverse effects? Are they still getting sick? How long they're protected for? So there's a lot of information that we're going to be getting over the next several years about this. But we certainly know that right now, the results are very positive. And so for that reason alone, this vaccine is nothing to scoff about. It's nothing, I think, to sort of dismiss. And the effectiveness we have to really celebrate as we all partake in that particular vaccination.
All right, thank you very much.
Thank you.
That was wonderful information, and certainly something for all of us to take to heart as we prepare for the holidays. We certainly all want to keep ourselves safe and healthy, but also one of the best things it sounds like we can do to keep our loved ones healthy, especially those who are at higher risk, is to make our holiday gatherings virtual. And we're really blessed to live in a time when we can do that. So again, thank you for the message that you shared with us, that we need to continue to be vigilant, sounds like, and that we need to continue to consider each other. We're in this together, and certainly we've been through pandemics in the past. We've made it through them, and this one is just a different one. We'll get through this one as well, though. So thank you again, Dr. McFadden. Thank you, Rhonda,
Thank you.
For the wonderful conversation that we were able to be a part of. And we want to make sure that all of you will join us on Thursdays. We have been, for the past 5 or 6 months, been providing masks in the community. So if you or someone you know does not have a face mask or does not have face masks, because of course we're wearing these every day, and sometimes you may even need multiple face masks. We do have reusable face masks, and we will continue to provide those in the community to ensure that everyone has what they need to continue to be safe. Also, we are really excited that we'll be working with South Carolina DHEC to have a COVID testing event later on this month. Details are coming soon, but we certainly appreciate all the partners who are helping us with our COVID testing event that will be later on. We want to make sure that we go into 2021 positive, that we're negative. And if we do find out that we're positive, we want to make sure that we don't spread that to anyone else. So again, we want to go into the holidays and after ensuring that we are healthy and that we are leaving our loved ones healthy as well.
Can I use that quote? We want to make sure that we're positive, that we're negative somewhere.
Absolutely.
I'll give you credit for it, all right?
No, you don't give me credit. You can give DHEC credit for that one.
Okay, I like that.
One of their slogans that they recently came up with. So we are going to run with that. And I think that they would be happy for all of us to share that we should go into 2021 positive, that we are negative. I also want to invite Tiffany Jamz, who is here with us from End Coronavirus, South Carolina. EndCoronavirus.org is an international organization that is sharing, again, a wonderful message of solidarity for all of us to be able to get through this together. So Tiffany, if you are still with us and want to share a little bit about your organization, we do invite you to do so.
Yes, I am still here. Thank you so much for having me. And thank you, Rhonda Rawlings and Dr. McFadden. That was a wonderful interview, great information. And I'm just sitting here nodding my head the whole time like, yep, that's what we be telling people. So I was in your amen corner. So thank you so much for sharing your information with us. So I'm with End Coronavirus, South Carolina, and what we're a coalition. We're not an organization, but we're a coalition of government entities, organizations, and community members and churches around the state. And we're just getting together, putting our resources together to combat COVID. And some of the things that we've done so far, we've donated masks to GreenLink for the bus riders early this spring. That's one of the things we've done. We've done food drives with churches. We've also advocated to get more testing. So at the beginning, there wasn't a lot of testing. There still isn't enough testing. But what we did was speak with Providence Hospital in Fairfield County, and they were open to doing CT scan testing because of the lack of testing that was available in rural areas. So as long as someone's doctor wrote them a prescription and said that, hey, yeah, you have the symptoms, if you would like to get this test, here's a prescription to get a CT scan, then they were able to do it. So that's one of the things that we're advocating for is looking at different testing options. Just to give people other opportunities for testing. Also, we have a partnership with Eau Claire Cooperative Health. They will be working with us to, get clients. So if people do not have a doctor, we will recommend that they go to Claire Cooperative Health to get prescriptions if they would like to get a CT scan for COVID testing. We've also been advocating to get isolation spaces. So about 80% of the disease is transmitted within families. And I heard Dr. McFadden talking about it. Just because you love someone doesn't mean that they don't have the virus. That is so important. And that is just the hardest message to get through to people, even people within my own family. I had so many family members travel state lines to go visit each other. I said, you're not coming here, but be careful, be safe. And I mean, there's only so much you can do. People are going to make the decisions that they want. It's just important that they're armed with all the knowledge possible in order to be as safe as possible. So yes, we are advocating for isolation spaces because particularly in Black and brown neighborhoods, we live in apartments, we live in compact areas. We don't have a lot of homeowners. So we live in areas where there's a lot of shared spaces, sharing laundry mats, sharing common areas, sharing a lot of spaces. So, and a lot of us are essential workers. So, we're going into restaurants working, we're going into stores working, and then we come back to shared areas. We come back to our 2-bedroom homes and spread it to grandma. And, because we have multi-generational families living together as well. So we are catching the disease at a higher rate than white people. And we don't have the option. We don't have the money to get a hotel room, if we want to isolate outside our homes. So Fairfield County Administration, they donated a 5-bedroom home that they own to our cause. So if we do come across someone who says we're positive, they will let them use that space for free. So we're really happy with their cooperation. And it could not be done without, Annie McDaniel, Representative Annie McDaniel stepping in and connecting us to the right people. And then, and she was just amazing. She just connected us and just let us, you know, work and do our thing and collaborate with different people. So we need the assistance of elected officials to help provide isolation spaces, because we have the mask. We're getting the messages about the mask, and we still need to push that message even more so. We're getting the message about testing. We still need to push that message, but we really need to isolate people if they are positive, because after you get tested, if you're positive, now what? And so that's what we really want to do, is try to find ways to provide somebody with a place to stay, food to eat, and to be taken care of if they're not able to do so. So that's just a few things that we're doing. If you want to be a part of this coalition, I can send you my email. I'll put my email in the link, and then I can send you some partnership forms. And we would love to have you on board. And what we do, we ask organizations, whatever you can do to help out with our collective effort. That's, you know, that's what we want. Whatever you can do. Eat Smart, Move More, South Carolina. They said, well, we can help find funding for food projects. So when they do distribute food, then they can also distribute information as well. So to the people who are receiving the food. So this is going to take, you know, organizations on the ground. It's going to take the government. It's going to take healthcare workers. It's going to take community organizers. It's going to take all of us to come together to work on one big collective effort and to offer what we have and what we're already doing to this cause. So
thank you so much, Tiffany. And Tiffany's email is in the chat. And then I believe there's also a website if you wanted to share that with us.
Yeah.
And we can also find out more information about In Coronavirus SC on the website as well. And I also included in the chat box our Giving Tuesday match is still going on. We again are working to raise $15,000, and we have a few wonderful donors who have agreed to match donations up to $7,000. So we do invite you again to join us in our giving campaign today, but also all through the month. So please do continue to share that Sustaining Way, similar to the type of work that Tiffany just described, working together in community to ensure that community members have the basic things they need, like access to food and access to PPE and access to testing. Those are the types of things that Sustaining Way does throughout the year, but especially during COVID-19, we are definitely aware of the needs that are currently existing in this community, especially in Nicholtown, as we found out just recently from a recent Furman study that Nicholtown is actually one of the most food insecure communities in Greenville County. So we want to make sure through our efforts that we are helping to increase access during this trying time for so many people. We also want to invite you to take part in our survey. We will have a survey go in just a few minutes on your screen. And while we are getting that ready to be shown on the screen, we do want to give one last announcement about our housing security series. In addition to food security that we're all working together to ensure, we're also working along with the Nicholtown Neighborhood Association, the City of Greenville, the Greenville Housing Fund, and others to ensure that Nicholtown residents are housing secure. There are several challenges that we are all going to be facing soon. One includes the end of the rent moratorium, but also some of the challenges that community members have been facing for a long time around the rising cost to just live in the community, as well as the rising cost of energy, just being able to keep the lights on. Those are challenges that community members faced even before the pandemic. So we definitely want to make sure that we highlight those and offer resources as well as talk about things that we can do collectively to ensure that these challenges are brought to the attention of our representatives. So again, please join us for our next event, the Nicholtown Housing Security event, and it's a series that will kick off on December 10th, Thursday, December 10th, so next Thursday at 6:30 p.m. And with that, I believe that our survey is ready to go live. Our poll. Do we have the poll ready?
It was already sent.
Oh, thank you. I completely missed it. Thank you so much for being so quick with that, Amber. All right, so we're going to go ahead then and close out. We do have a tour. Some of you have been with us on this tour before. For those of you who have not had an opportunity to tour Annie's house by Sustaining Way in Nicholtown, we invite you to, on your devices, click on the link in the chat box so that you can see the tour of our highly energy efficient property in Nicholtown. We are demonstrating ways that we can all live more sustainably, and we hope that you will join us in person when we can do so safely. We do have events from time to time that are outdoors, including volunteer opportunities to be able to volunteer in our edible landscape. But we, of course, will open up our doors for you to be able to come in again once we have the all cleared so that we can keep everyone safe. But please do take a look at our virtual tour. The link is in the chat box. And of course, we will be here for a few more minutes. So if you have any questions, we invite you to ask your questions, hang out with us for a few minutes. But again, thank you so much. And we look forward to seeing you again, either at our December 10th event or at one of our upcoming volunteer opportunities or our testing event at the end of the month. Thank you again for everyone joining us.